I'm Dr. Voon, and today, on behalf of the Intensive Course of Obstetric Emergencies, ICO, I'm going to demonstrate to you how we perform a fast scan in pregnancy. Now, if you follow me, we have a lady here who's in early pregnancy, about 11 weeks and 5 days. So assuming she comes to ETD, hemodynamically unstable, and you want to know what's happening, now you can do a very quick bedside scan. You don't need a high-end ultrasound machine like ours. Suffice to say, you can use any of the usual probes. So what we're going to do first is to focus over here, right over the symphysis pubis. As you can see on the arrow here, that's the uterus. You can be sure that this is an intrauterine pregnancy now because you can see the uterus outline. Ideally, you should be following the cervix. So we want to focus outside of the uterus when we're doing a fast scan. Now it's important to increase your angle to make sure you have an overview. So that increases the angle of your scan. That's the bladder here in front. Use that as your landmark, and behind the bladder is usually where the cervix is. That's the outline of the uterus. You're going to look over here to look for whether there's any collection in the POD, particularly when women are lying down. You can see the cervix here perfectly, and there's no collection behind. Those are loops of bowel there. Sometimes you can see movement. So fine, there's no collection around the POD, there's no collection around the uterus, because if there's fluid around here, you will see the uterus outline being much better. Now you'll move on next to two important areas over the Morrison's pouch here. So you might need to increase the gain. Now your guide is to look at the area between the liver and the kidney. Between the liver and the kidney. So if you see hypoechoic or anechoic area, that means that there is blood or fluid collection. So that's the kidney here, that's the liver, and that's the Morrison's pouch. Now you can also do the same thing on the other side, on the left side, as you try to look for the kidney here, and you will be bothered by the spleen. Can you hold your breath for a while? 1, 2, 3, hold your breath. So sometimes it's easier because of the shadowing from the ribs to get patient to inhale and exhale. You can see the spleen there, and you can see the kidney on this side. So that's how we assess for intra-abdominal bleeding in an emergency setting. These areas in the pouch, in the pouch of Douglas or the Morrison's pouch, are the most dependent areas when patients are sitting or lying down, and therefore fluid or bleeding tends to collect in these areas. So it's important to just focus and have a quick look at it. Thank you very much.